Okay, so I just wanted to tell you guys about this procedure. It's called the HSG procedure, and it's usually done on women that may have blockage in their fallopian tube, or fallopian tube may be blocked. So it's a procedure that you go in, it's an x-ray machine, some devices that's used, and it basically tests your flow from your uterus to your fallopian tube. So I just want to say, if you've never ever gotten this procedure done, it is painful. I've actually gotten done 3 times. I do not remember the pain that I experienced with it before, but it definitely was pain. So basically what happens is you go in, they tell you to use, take ibuprofen the night before and then 30 minutes before. I did both. And basically like you're taking your clothes off or the bottom part of your clothes. I've got it done at 2 different facilities. One facility was a infertility clinic where they had the machine there. And this time I got it done at like a hospital, outpatient services for the hospital. So I got it done 2 different places. So one of I don't remember it hurting when I was at the clinic. I remember the pain, the cramping, but not like intense hurts. I don't remember that. But today I got it done at the hospital, and I have to say that this is one of the most painful experiences that I've ever had. And they basically use this device. So they put the clamp inside of your vagina and open it up. Then they use this device. It's a long tube, almost catheter-like. And at the end of it, at one end, you're able to, almost like a syringe, where you're able to put the fluid in. And the second, the other part of the end, it's like a bubble that opens up inside. So basically what I was told was that once they put the tube in, they put the tube into your cervix, so they can bring your uterus down. And what happens, why they have to bring it down, because they have to clog up your uterus so the contrast doesn't flow back down the opposite way and is forced to go through your fallopian tube. So, okay. Clamp in, uncomfortable. We all know, we're women. We know, we go to the gynecologist, the clamp's uncomfortable. Okay, clamp in, it was uncomfortable. Then after that, they put the tube in my cervix. Very uncomfortable. Like, ugh, it hurts, right? But not that big of a deal. It's painful, but not like, oh my gosh. Once they start to insert the contrast, that's when all hell broke loose. So I'm laying there, I'm on the table, my legs are, spread apart or whatever. They got the clamp in, they inserted the tube, and then once they insert the tube, the outside of the tube is taken out because it's just bigger to put the tube in so it doesn't bend. But once the tube is in, they take that piece out. Didn't relieve any pain for me, like even with it being taken out. So they insert the dye, the contrast in, and I flipped. Like, it was so painful. I was screaming, or whatever. Like, I'm like, oh shit. Like, I don't even curse like that. So I'm like, oh, and I'm like, I'm so sorry. Like, I didn't mean to curse. And she's like, it's okay. So the lady's giving me her hand. I felt like I'm having a whole baby in there. She's letting me hold her hand, squeeze her hand. So, wilding out now. My other hand is like moving because it's so painful, so I moved the whole x-ray machine. So she has to bring the x-ray machine back or whatever, which took longer for them to put the dye in because they can't see because I moved the x-ray machine. So she brought the x-ray machine back and she's like, just squeeze my hand. So basically they did it, and then they show you the screen, and on the screen you can see the dye kind of spewing out of the sides of your uterus, out of your fallopian tubes. So basically this procedure is just to make sure that when the sperm is inside of your body, it has a passage to the fallopian tube, and then as well, I forgot what it's called, phalanges or something like that. The tips of your fallopian tubes are actually open, so when your ovaries produce the egg, it can go inside your fallopian tubes and meet the sperm. So if there's a clog inside, the sperm can't get through. And then if the tips, the finger-like tips of the fallopian tubes are closed, the egg can't get through. So it's like they have to both be able to meet at a common ground. So if one can't get through or the other, the sperm is not going to be able to, meet the egg or whatever. So it's a really important procedure if you're having trouble getting pregnant or whatever. And then they say some doctors will say it, some doctors won't, but basically it's a cleanse. So if there is anything in there or a blockage and it pushes it through or pushes it open, once is the perfect time to try to have a baby at that point, because now your fallopian tubes are kind of like cleansed. So that's the thing. So everyone knows, whether you believe in God or not, there's some things that are unexplained with pregnancy. Sometimes they can say, oh, you're not ovulating, so give you some medicine for ovulation. But when you're ovulating and everything's fine, nothing's wrong, your levels are fine, there's no diseases or underlying issues, it's unexplainable. And it's unexplainable because the fact that process of making human or mankind is not our process. It is not scientific. It is very much so God's grace, to be honest. Like, I've been going through this process for, I want to say, like 10 years now. And no matter the doctor, no matter the clinic, no matter the state, I've had it done in 3 different states through moving, no matter any of that, everyone says they can get you here, but they don't know why it's not happening once inside. Everything's clear. So that's why they have IVF and IUI. IVF, in vitro fertilization, is when they take your egg out when you're producing the egg. They take the egg out, they take the sperm from him, they use a petri dish, they inseminate the egg with the sperm and cook it up and then put it into your uterus, okay? So not something that I would want to do. Like, I'm just not going that far. Now, IUI is a little better. It's a little bit less messy, meaning that the humans really don't have that much to do with it. And you're producing your own egg. And basically what the doctor does is take the sperm and insert it inside your egg inside your body already. So your body is just literally being fertilized, and all it has to do is find itself to your uterus, attach on, and boom, there's the baby. So that would be a better process if you don't want, the doctors to have too much to do with allowing you to have a child. So I just want to say these processes are not easy. They're very disheartening. Going through the processes and painful, and for us women, it's more painful than a man. All the man has to do is go get his sperm tested, and if his sperm is fine, that's it. That's all you got to do. But for us women, it's multiple procedures. I've had this done 3 times. I've had the procedure where they put the saline around your uterus to make sure that there's no fibroids or any of those abscesses or any of those things. I've done that. I've done through multiple tests and multiple blood work, all of that stuff, and I'm perfectly fine. Nothing's wrong with me. So this, I told my significant other today, I'm like, hey, this is the last test I'm doing. I'm not going again. I'm not doing anything else. So it's now or never. Like, it has to be done. I'm not doing any more tests. So trust me, if you are going through these procedures, you are not alone. I have been going through these procedures. I've been in 2 different relationships. So for the first 4 years that I've started, I was with an ex, and then I've been in this relationship for 5 years, and normal stuff for 3 years. And then we started talking about it more. And then, I started to do it again and see if anything's changed, and it's fine. So the doctors are now like, I can't tell you why you're not getting pregnant yet. It's just not happening, but scientifically, you're fine. There's nothing wrong with you. So again, if you are going through this procedure, and I don't know if you can tell, but I'm pretty young. I'm not old or whatever, or older, should I say, excuse me for my older women. I'm not an older woman, so I don't have the biological things against me as far as maybe I'm not producing as much eggs or stuff like that. I'm fairly young. So if you're young and you're going through this, my prayers are with you. Trust me, I understand your hurt, your pain, your disappointment, your disgust. I get it. So just if you want to comment, leave something in the comments. I have a couple of more pages, a couple of more videos that I'm going to put up. And I'm just going to keep going on with my natural way, and then maybe in a couple of months, because it's been a complete year of us trying consistently, so in a couple of months we'll table IUIs and see if that's an option. Like I said, IVF is absolutely not an option for me, but IUI may be. So yeah, so if that's something that you're going through, like I said, my prayers are with you. You're not the only one, and yes, I understand and I agree. Why me? Why does it have to happen to me? I want a baby. I want to love a baby. I've been through it. I've been through the pain, the hurt, the crying, the anger. So you are not alone. And again, you can leave a message, a comment in the comment section, and we can talk about it. I was thinking about making a blog just for people to be able to discuss their transition, because for us, sometimes the men don't feel what we feel and don't feel every time they get their period the next month that it's just a moment of silence. Like, really, like, you know, especially when you're charting and you're doing calendars and marking and ovulation kits, and it's just exhausting. It's pricey, and it's just very exhausting for me. So I know it is for you. So hang in there, girl. No matter the race, color, or creed, we're all women, and we all have seen this within ourselves, a family member, a close friend. Infertility is an issue. And unfortunately, being in the infertility clinics, I know that it has no skin color. I've seen them all different races, all different colors, all different creeds, all different backgrounds, English speakers, non-English speakers. It happens. It is something that we go through, unfortunately. So hang in there, and I hope you enjoyed my video. Trust me, I've been through it all. So if you have a question about another procedure, just shoot me a comment, and I am absolutely sure that I have had that procedure before, and can give you some tips and pointers. Thanks. Bye.